Hello, my name is Kushal. I work as an occupational therapist in London. I've been working for 17 years and I have come across different conditions, and I'm going to talk about one of the conditions, that is frozen shoulder, which one of my followers have requested for some advice. Obviously, frozen shoulder refers to our shoulder joint is like that. This is our, if that is the bone, and that bone at the top has a ball, and there's a socket here that sits in there, and that socket has the bones are attached with tendons, and muscles are attached with lots of ligaments and so on, and there's a kind of fluid that allows the joint to move, and that allows us to move forward and backward and all that. So in frozen shoulder, due to the muscle stiffness and a number of other factors, the joints gets a bit stiff, so it doesn't move that freely. Again, I am explaining things in very brief, in very layman's terms, so that people can understand. If you want to know details, please do a Google search. You'll find a lot of information that gives a lot of more anatomical information. So please remember, this is just to give you an idea. It's not for full explanation, because my videos are meant for people to understand and get the treatment. That's the main thing. But with frozen shoulder comes pain. I'm going to show you 2 exercises today, but you have to be careful. If you do the first exercise first, if you are okay, do that for a few weeks, and once if you see that it is getting better, easier, the pain is becoming less, then go on to the next one. But if your pain is increasing, I strongly suggest that you stop doing the exercises and you ask a qualified physio or your doctor for some advice. So these exercises are only for if you have been given a diagnosis of frozen shoulder, because shoulder pain can be related to lots of things. If you have a shoulder subluxation or something, that is completely different. But if you have been given a diagnosis of frozen shoulder, then only do these exercises, okay? Now let's talk about the exercises. The first exercise is best done if you put your hand on a table or something. If this shoulder is frozen, you put your hand on a surface and you rest yourself and you lean forward. So when I'm leaning forward, you can see I have allowed the hand to hang completely freely. So it is hanging like a pendulum. If you drop your hand but still keep it stiff so that it is not moving freely, it will not work. You have to let it go. Like my hand is feeling, I'm not swinging it, it is swinging itself. Okay, let it go free and then make small circles. And this is called pendulum exercise. Both ways, small circles, and your aim is to increase the circle radius, diameter, to something like this. So start with very small and gradually increase the circle diameter. That's a very good effective exercise. I think you will benefit from it if you have been given diagnosis of frozen shoulder, but again, check with your healthcare professional. The second one, if this exercise is going okay for a couple of weeks and you're seeing your shoulder is getting better, then you can take a towel and hold the towel like this, and you can practice moving it side to side. Again, very gently, start with small movements. Don't go like this right at the beginning. Small movements, yeah? 1 or 2 movements, start with those of both exercises and see how it goes. If it is benefiting you, you use it, but if it is increasing pain, stop it. Please, please, please. Thanks for watching my video. If you like it, please put a like, and main thing is that please repost this video, because your friends and followers will learn this, and if they have a frozen shoulder, they can benefit from it. Thanks for watching my video. If you have any questions, please let me know. Wish you all the best.